The Balance of Well-Being, the Alexander Technique, a unique approach to changing your life by changing your posture.
Hello and welcome. My name is William Hurt. I would like to introduce you to someone who has the power to help you begin to take your back pain away. Deborah Kaplan. Deborah is a master teacher of the Alexander Technique, a physical therapist and author of the book Back Trouble. Today, Deborah is going to use the Alexander Technique to help you begin to take your back pain away. Deborah Kaplan.
Thank you, William, for the introduction and for introducing the Alexander Technique. Hello and welcome. If you have back pain, shoulder, or neck pain, you are probably finding it uncomfortable and even painful to move around. That's why it's so important to know that there is a way of moving that is harmful for the body and a way of moving that is beneficial and can help the body heal. You're going to learn how to change harmful ways of moving into beneficial ways by learning the Alexander Technique. This technique has proved to be a powerful therapeutic tool when dealing with back problems. Sneezing is not a frivolous topic because it is one of the most fear-provoking events for someone who has low back pain. Gary is going to show us an incorrect way of sneezing and then some ways that you can protect your back if you have to sneeze. Gary, what is the problem that you've had with your back?
I was injured in an accident in which I suffered hip and lower back pain.
Was there ever a time when it was scary for you to have to sneeze?
Oh yes, there were many times where I'd feel the urge to sneeze, and just as I'd be about to sneeze, I'd be gripping in fear that my back would be injured.
What makes sneezing so treacherous for the low back is that it's a sudden, very strong force on the low back. And if you bend at the waist incorrectly, when you sneeze, the structures of the spine, the discs, ligaments, muscles, and so forth, joints, can really suffer injury. So, Gary, show us an incorrect, the wrong way to sneeze.
Okay.
But don't hurt your back.
I'll try not to.
All right, take a look at Gary's back. This is harmful for the back because he's bending at the waist, which means that the muscles that protect the structures of the back are not working. Now, come on up, Gary, and let's show some ways to sneeze that protect your back. So come on closer to the chair. When you feel a sneeze coming on, the first thing you're going to do is quickly bend your knees and then put one hand on a piece of furniture that you happen to be near so that you brace your back so that it doesn't bend. So the principle here is knees bending and having one hand on an object that will help you maintain the lengthening alignment in your spine. Okay, show us how to do this. Excellent. All right, but suppose Gary is not near any object that he can put his hands on. Here you're going to, again, bend your knees and put one hand on a knee to brace, that's it, to brace your back. And also realize that you're really going into monkey position when you sneeze correctly. So there's that monkey position again.
All right.
Okay, and come on up, and let's see that. Okay, very good. And please notice the alignment of Gary's back. Even though he's forcefully sneezed, the structures of his back are protected because the muscles are engaged and he's maintaining the length of the whole torso. And now come on up.